confronted with problems and provide the full variety of treatments that have been shown to be effective for particular problems. Most important, it is my hope that this book will provide reassurance, encouragement, and general support for parents along the sometimes stressful journey of parenting by empowering them with the most important tool of all, information. In Part 1, What Every Parent Should Know About Child Psychology and Mental Health Disorders, I provide an overview of the issues involved in diagnosing and treating psychological disorders. I present common concerns that parents might have and provide information about normal child development so that parents can determine whether their child's issues fall within the normal range. In Part 1, I also provide information about the diagnostic process and treatment possibilities. In Chapter 1, I present an overview of the types of problematic behaviors that children may exhibit at different times in development and provide background in helping parents decide whether to go ahead and have their child evaluated for possible treatment. In Chapter 2, I provide general guidelines as to when to seek help, the elements of different types of evaluations, and what to look for in a competent professional. I review the possible choices parents have. For example, psychiatric evaluation, consultation with a psychologist, neuropsychological testing, meeting with the school psychologist, and explain the positive and possible negatives of each possibility. In Chapter 3, I help orient parents to the possible treatments that are available within psychology and psychiatry. This chapter includes explanations of terms such as cognitive behavior therapy, psychodynamic therapy, family therapy, and play therapy. School-based, clinic-based, and hospital-based treatments are reviewed. In Part 2, Common Childhood Disorders, I provide information about common symptoms, biology, causes, course, that is, what happens to a child with this disorder over time, and treatment options for the major psychological and learning disorders that are seen in children and adolescents. In each chapter, I discuss the best treatment options and where to seek each type of treatment. For example, hospital, school, licensed psychologist, psychiatrist. Disorders include attention deficit hyperactivity disorder, autism and pervasive developmental disorders, mood disorders such as depression and bipolar disorder, anxiety disorders, learning disabilities, and eating disorders. In Part 3, The Treatments, I review detailed information on the treatments referred to in Parts 1 and 2, how therapists think the treatments work, which disorders they are used to treat, the typical course of treatment, and what to look for to determine whether the treatment is effective. Treatments include insight-oriented therapies, play therapy, cognitive behavior therapy, family therapy, school-based services, and allied treatments such as medication, occupational therapy, and speech therapy. Finally, the book includes resources that provide an annotated list of organizations that promote mental health in children and adolescents, as well as books and websites for particular disorders. You may not listen to this book from start to finish, although it might be helpful to listen to Part 1 and then go to the chapters that focus more on your child's diagnostic or treatment needs. In contrast, you might find yourself listening to the book straight through because it can inform you about issues that you had never thought of. One thing to consider is that it is quite common for psychological disorders to coexist. In other words, many children have more than one disorder. Furthermore, it is quite common for treating professionals to use more than one approach. A psychologist may use techniques from cognitive behavior therapy along with play therapy, or a child may receive school-based services and medication. The combinations of treatment approaches are endless. Thus, it is quite likely that if you have sought treatment, more than one chapter in Part 3 may apply to you. This book won't answer all your questions, nor will it enable you to determine your child's exact diagnosis or best treatment. It may help you along this process by providing you with information to ask the right questions while helping you better understand the process. The resources at the end of the book provide helpful information about where to go from here. Above all, know that you are not alone in this process.